First dollars of Ohio's American Rescue Plan Act funding is going to mental health care for children. We're talking about $84 million here, but advocates think it's going to miss a very critical mark. Reporter Larry Seward explains.
Between lockdowns and fear of catching the virus, remote learning pushed Claire Lerone Patterson's family to the brink.
Although I really understood the decision in terms of public safety, for my kids' mental health, my own mental health, it was very difficult.
According to the region's Mental Health and Addiction Coalition, schools are where 70% of children first meet therapists. So when coronavirus closed campuses, referrals fell off, dragging critical jobs over a cliff. This study found unscheduled virtual therapy visits for children up more than 100%. Now, this $84 million lifeline from lawmakers gives schools and other providers new money to spend on child mental health care.
Something that the state simply has to address.
But after the pandemic, key providers are missing in action. We're talking child and adolescent psychiatrists. Hamilton County has what this study calls a high shortage. All of its neighbors are worse off. Brown, Highlands, and Adams counties have none.
We probably have seen the fewest amount of resumes coming in since I've been here at Talbert House and really in this field.
When referrals dropped off, Talbert House left vacant positions open. Now they're struggling to find people to handle increasing demand for children.
Some of this money really needs to get to the mental health providers themselves instead of everything going through the schools.
Susan Shelton runs Mindpiece, a nonprofit with a network of in-school mental health providers in 184 schools. She sees a therapist shortage causing problems that House Bill 168 does not touch.
Right now, because of the reimbursement rates of private and public insurance, therapists who require 6 years of education plus additional work on licensing, they really make a very low level salary and still have to pay back their loans.
So while she cheers the state's investment in the welfare of children, Shelton sees key infrastructure needing help too. In the meantime, therapists told us that the amount of resources available should not stop parents from calling for help, especially if their child is avoiding friends, staying inside more, and becoming more withdrawn. Larry Seward, WCPO 9 News.